Cynthia Perry. I am a speech language pathologist. I have a private practice in DC and Maryland. I coach SLPs on improving their revenue streams, managing revenue streams, and practicing at the top of the license, meaning performing the jobs that they can do in the best possible way, and delegating when they need to, which are all things that I am still struggling with. That doesn't sound good, but I think that's why it's my area of passion, because I can, I relate and I understand. It's a constant struggle. Okay, so the first question that I have, so I've just been compiling my questions. This person is asking, and I'm not going to say your name, looking at platforms that offer online scheduling and prepay to schedule, do you have any recommendations? I'm considering Jane and Simple Practice. Also wondering if you enter EMR info and then switch platforms. How do you transition data assuming if you're no longer paying for a program, you lose access to previous records? Okay, so I basically responded, but I wanted to share this because I thought that this might be something that other people have questions about. So in my question, yeah, I know it's you. In my question, in my response, I let her know that I do use Simple Practice to serve as my EHR platform for my electronic health records. So with Simple Practice, it's pretty easy. And I like this question because this person must know, I don't know, but I did use Jane in the past. I've used Jane for a while and I was pretty vocal about Jane. And I do think that the interface with Jane is really nice. I also enjoy the interface with Simple Practice, but with Jane, I was finding it very difficult to manage my revenue because Jane, at the time when I was using Jane, this was last year, Jane did not have a calendar view. Jane did not integrate well with my calendars, like Google Calendar or Outlook. Notion Calendar wasn't out at the time, so I couldn't integrate Jane with that, which meant, and Jane only had a weekly view or a daily view. So it's 52 weeks in a year. So if somebody is only giving you a weekly view, it's going to be real hard for you to predict your revenue. And it's also going to be really hard to go back. And one thing I didn't mention is I'm an insurance-based practice. So meaning the bulk of my revenue comes from insurance. Most speech language pathology practices, to my understanding, are not insurance-based. They might, I think a good percentage are, and many of them do take insurance. But if you've ever needed speech therapy and you've called, let's just say 5 practices, I guarantee you 2 out of the 5 don't take insurance at all, maybe even 3. I believe that more speech language pathologists, especially those who are in private practice and they're like a solopreneur, or one SLP and maybe one assistant, or one SLP and another SLP, a small practice with like 5 or less people, they probably don't take insurance. So that being said, it is very difficult to find someone in network who's a provider and then someone that you like. So if you're in a smaller city, smaller town, that is a challenge, but that's also a benefit for us who do take insurance, because that means we have a clientele ready for us because we are in network. And so the process is easier. And if you had a choice, unless money is not an option for you, why would you pay out of pocket if you could pay a copay? So that's why a lot of people, will run to you. Now, me being an insurance-based company, when I was accepting Jane, I could not submit claims through Jane easily. Jane is a company based in Canada. So it was really challenging for me to submit claims because they were still trying to figure out the US insurance-based system, which I teach a course on that. Okay, so literally, I teach contemporary issues and policies at Howard University, and we spend quite some time talking about the United States insurance system. It is not easy to understand. The US healthcare system is very complicated, and it is profit driven. So if you don't understand how to navigate the system, it can be a challenge for you if you have health issue. So with that being said, I prefer Simple Practice. I left Simple Practice for Jane. I tried Jane for a while, but because I could not submit claims through Jane, I was losing so much money. Oh my goodness, I'm embarrassed to say. I have so much money that is just out there in insurance land. And after, if you bill insurance, you know that after a while, once you let a certain period of time go by, you can no longer submit those claims. So that money is just gone. Like I was just a wash. So I lost money dealing with Jane. Not only did I have to pay the subscriptions, but I also had to like eat, the money that I would have earned for different services. And I really understand why a lot of speech language pathologists don't deal with insurance for this reason. It is a challenge, and so my biller is on is on the call now, and she could tell you, like, if she were here, she'd be telling you it's not easy, but it's worth it because it really feels good to give therapy to people who otherwise would not find someone like me to give them the services. That it really feels like a blessing. I think God is giving me extra points sometimes because I'm able to provide a service, and I believe a high quality service for people who would otherwise be going to the community clinic. And who knows who would be serving them, and how, what, not to say that every community clinic is bad, but you know, they, it's not going to be a more of a private type of experience. So I'm really grateful to be able to help people, to be able to give people a second opinion, and to be able to serve people of color, especially, but not just all my clients are not of color, but it's hard to find diversity in our field in terms of providers, and I'm happy to be one who accepts insurance. I'll just put it that way. So in the end, I would recommend Simple Practice because Simple Practice, and again, I have to disclose that I am on the board of a consumer advisory board, but I just got selected for this board this year. And I'm referencing stuff from last year, 2023. So yeah, I still would use Simple Practice, even if I weren't on the board. And who knows if I'll be on it next year. I'm still more than likely going to be using it unless a better system comes out that has better rates and perhaps better telehealth and allows me to bill in a similar manner as Simple Practice, because they really make billing easy. Okay. So to answer your question, you can do Jane. If you are not taking insurance and you're not billing insurance, then by all means use Jane. But if Jane has not updated that calendar view to a monthly view, I still would not use Jane. I think that you really need to have a monthly view in order for you to understand revenue cycle management, for you to be able to identify how much you made last month, month before. I'm sure Jane does let you print reports, so don't get it twisted. You can print reports, but there's value in viewing that revenue from that monthly calendar. I just really enjoy having the calendar view and being able to plan my sessions with other providers in my practice, being able to see what their calendar looks like. The Simple Practice calendar is color coded. So for those reasons, I got to go with Simple Practice. Okay. I know I spent a lot of time. That was just one question. Okay. Then they said, so I guess the second part of this question was, if I'm no longer paying for a program, do I lose access to previous records? No, it depends on the program that you're using. But with regard to Jane and Simple Practice, both of them will let you download files, your client files or your records, into a zip file. And usually you can upload that to the new system that you're using. So usually, I don't know how Clinic Note works, or Clinic Source works, or Practice Fusion works. I did try Practice Fusion for a while, but I didn't have that many patients at the time that I put into that system. So, but usually you can download the entire practice documents into a file and then upload that into your system. If that doesn't work, then you'll have to go client by client and download their files, but you should be able to bulk download each client's files into a system. So when I transitioned from one system to the next, I was paying 2 monthly rates for both systems because I wanted to give myself and my practice time to move everything out of one system into the other. And we did that only to move everything back about 6 months later, because like I told you, I was losing money trying to submit claims using Jane because Jane would not allow me to, I would still need to go into Availity to submit my claims. I could not submit the claims through Jane. I could only prepare the claims in Jane. Then I would have to download them, and I would need to do a bulk download and then go into Availity and upload that. And my biller can speak to that issue because we started off billing through Availity before we got Simple Practice. So yeah, have fun with that. Like any extra step, and that just seems like, oh, it's one extra step. No, any extra step is going to be a challenge because if you're manually downloading claims, that means you have to go back and manually put in the payments. And we already still sometimes have to update payments, even in Simple Practice. But Simple Practice EHI and EDI, system, it speaks directly with the marketplace. So when we get paid for a claim, generally the amount that we get paid goes right back into Simple Practice. It updates in the client record and it's easy. Occasionally we have to fix things. Of course, with Medicaid, we have to bill Medicaid in the Medicaid system because that's how Medicaid works. But that's the only thing that we typically have to bill out of the system, or our EHR is through Medicaid or Medicare. And I don't bill Medicare right now. So I only have to worry about Medicaid. And that still to me is much better than everybody. Just imagine, TRICARE, Humana, United, just whoever you're billing with, all of those commercial insurance policies, you have to download those claims and submit through Availity. It's just too much. No. But if Jane has updated that and you can bill a claim through Jane, if anyone knows, like, let me know. I think that would be, worthwhile. Okay, so someone else says looking at platforms that offer online scheduling and prepay to schedule. Oh, sorry, that we read that. Okay. Someone asked about billing out of network, and it looks like I didn't clearly see the question, but she asked about billing out of network and if it works to bill out of network using Care First, how can she get reimbursed using her SLPA to bill out of network? And basically I told her it doesn't work. You cannot use your assistance fully to bill out of network. CFs are a little bit different because CFs are actually clinicians practicing under your license. I mean, technically in some states, SLPAs are licensed, but the problem with SLPAs is even though they are licensed to practice in the state, most insurers will not reimburse for SLPA services. Most insurers reimburse for services provided by a clinician. A fully licensed independent clinician. Let me say that because an SLPA is a clinician, right? But I mean a fully licensed independent clinician. And they sometimes will, even have issues with CFs because the CF is usually functioning under your MPI. So you need like a group MPI oftentimes, and you can generally make it work. So to answer that question, can you bill insurance companies with an SLPA? I'm going to say no. Now, I am not insurance God, right? So other people may have other opinions about this, but according to what ASHA says, according to what Maryland and DC say, because those are the states I'm licensed in to practice in, you cannot bill insurance solely through services delivered by a speech language pathology assistant. Now, there are ways around that when you can still make yourself available to provide some level of service, or you can make yourself available to be in the service somehow, some way for the minimum amount of time that's required to bill a given code. If it's a code that requires a time allotment to it, then do that. And that way you can still maximize your time. You're not necessarily delivering the entire service, but you can still bill for that service because you made yourself available when the service was delivered and you met the minimum requirement. So specifically what I'm speaking of is like that 8-minute rule. So let's say you bill 92507, which is for speech and language treatment, right? Or therapy. And your SLPA provides the services. You can come and meet the client and work with the client for 8 minutes, because that's the 8-minute rule. If you're billing 1 unit, if you're billing 2 units, then you need to do 23 minutes. And you can be in the room, or the assistant can be providing the service. You can be in the room. You can, again, monitor what they're doing, speak to the family, provide, insight, things like that, so you're still getting help with the service, but you don't need to necessarily be there for the full duration. Let's say the duration of the service is 45 minutes, 30 minutes, 60 minutes, whatever. You don't necessarily have to be there for the entire time. You could also, there are also ways, there are ways that you can make it work for you. So don't look at it like, oh, I need to just, I can't bill insurance because I have a speech assistant. Not necessarily. Okay. Remember, my thing is practicing at the top of the license. So I'm never going to say don't have an assistant, because there is so much that goes into providing services. And an assistant can take a lot off of your plate. And I'm all about delegating. So if you have an assistant, maybe you can't bill, for all of the services that they provide. But like I said, if you're in an office and you have a patient in one room and a patient in another room, you would not be able to see those patients as quickly if you didn't have the assistant. So you can have the assistant in the room. You can come into the room, provide the services, talk to the family, do what you need to do for your minimum requirement of time, supervise the assistant to some degree if you'd like, and then let the assistant kind of finish carrying on the session, and you can hop into the next room. This is what physicians do, right? They have a medical assistant. They're not using the medical assistant to bill for a physical, right? An exam. No, the medical assistant is going to take your vitals, and they're going to get you situated, they're going to clean the room, get the room ready. And then the physician is going to come in. The physician might be in the room for 7 minutes with you, 8 minutes, right? The minimum required time. And then the physician is going to take their notes right in front of you for point of service, so that they don't have to walk away doing notes unless it's something extra that they want to say or do, or just some follow-up. But they're not going to do the bulk of the note away from you. They're going to do the bulk of the note in front of you. And then they're going to walk out. And then that assistant is going to come back in the room or remain in the room and finish providing the service. So, don't look at it like, oh, my assistant's not billing, so therefore I can't pay them or I can't work with them. An assistant is still very valuable, especially when you're new in practice, because like, you really going to pay another clinician. I would never recommend to a speech language pathologist who's starting out in private practice to ever get a loan. As tempting as it is, you don't alone. You don't want to use money that you are getting from other people to generate, or a line of credit to, have your business operations based upon, because then you're not knowing what you can really earn from insurance. And when you're earning money from insurance, it takes a few months before you can get to see trends. Once you see trends, then you can learn what to expect and what to not expect. And you can say, you know what, I may not have the budget for a speech language pathologist, but I got 35,000, 40,000 I could give to an assistant. And if you don't have that, you can say, you know what, I don't have 30,000 to give to an assistant, but I have 15,000, or I have 5,000, or, I have a relationship with this university, and I can get a student intern to work with me. And then I can maybe get an administrative person to support me either virtually or in the office. And those type of things really will help you be able to let your business flow much more smoothly. So, I highly recommend, like, don't look at it like, oh, I have to have, this in order to do that. No, just get started. Just do what you're doing. People really do need your services. People, really do need our services. And so, I think we do bless a lot of people, and assistants really help to keep you organized. And, like I said, they can clean up the room. They can sanitize the toys if you're using toys or whatever materials you're using. So yes, you may not be able to bill directly for all of the services that the assistant provides, but is the value still there? Absolutely. Absolutely. Don't look at it that way. We're not trying to get over on anyone. We're trying to do our job and get paid well for it. Okay. We're not trying to not show up and then bill. We're not trying to do that. Okay, so if you have a question, you can put your question in the chat, but if not, I'm gonna keep reading the questions that I have in front of me. So, okay, let's keep going. I'm just scrolling through, because some of these are screenshots. That is, oh, that was one. Let me go back. What did she say? And of course, I can't find it. Based on my hourly rate. This is just hourly rates. What do you charge? What is your, oh my gosh, my battery's low on Instagram. Y'all, Instagram, you might have to hop on Facebook because my battery is low. Facebook, my battery is fully charged, but my Instagram battery is low. So people are asking what they charge for private pay rates. So if I wanted business income of 100K, including expenses and taxes, wanted 4 weeks off of year and 20 sessions a week, here is the math, $100,000, 48 by 20, because you want 4 weeks off a year, so that's 48 weeks in a year. That's $104.16. With 100% attendance rate, that will be around 125 a session. You yield 96K with 80% attendance rate. So she's asking about charging rates. And then, yeah, just curious, what are you charging for out-of-pocket speech therapy evaluations and treatments, and what state you're in? I'm trying to decide. So a lot of people are saying that they charge $200, $300, $400. I charge $150 for speech, $150 for, I don't even think I charge $150 for language. I believe my rates are really low. And they need to go up. I want to say it's $300 for a full speech and language evaluation. And I believe it's $150 for language, but I don't know. It might be $200 for language. Language is not the same as speech. I would not charge the same. I don't think so. I would not charge the same for language as speech. I can actually pull up my rates. I don't even know them. Notion. Let me pull up my fee schedule. Sorry, Facebook, I gotta move you for a second. So. I charge. Okay, so I go on about how my sessions, range in time frame. And just to let you know, like my 30 minutes online for a child, especially if the child is independent, they can participate in therapy on their own. 45 minutes usually for adults. Sometimes we go to 60. Sometimes I go a little over the 30 minutes for children. Sometimes it's between 30, 40 minutes usually. Sometimes it goes to 60 minutes. It just depends, but normally I try to keep it short. Then in office sessions, they're generally there for 40 minutes, sometimes an hour. But again, remember, I'm not always providing the service for the whole hour. So home sessions as well, 45 minutes, but I stopped doing home sessions because of the time that it just takes me to travel between homes. So that's on pause. Now, my thing is that I do packages. So when I have private pay patients, I'm no longer doing individual. A lot of like SLPs that I deal with, they say they do, I do 154 session, I do 204 session, most people don't. They're lying. I mean, maybe they do, I don't know, but most sessions are like between $100 and $150. I want to say around 130. That's what I'm seeing in DC. So, I think if you're at $100, that's a very reasonable rate, but it's probably going to be for an hour, 45-minute or an hour-long session. It's not going to be for a 30-minute session, usually for $100. But if you, want to do that, hey, but that would mean that for an hour-long session, you charge $200. And so if you're that good, then go, by any means, go ahead. But I have found that when I provide speech therapy to people, I am providing speech therapy to get to an endpoint, right? So that means, and I do therapy in terms. So I do a fall winter term. That's what we're in right now. After this, we'll do a winter spring term. After that, we'll do a summer term. So I do 3 terms a year. My terms are normally around 12 weeks, sometimes at 12 to 15 weeks, but usually it's around 12 weeks. And my major aim is to do at least 10 weeks of therapy with my patients, because I know that in 10 weeks, I can get you where I need to get you. Most times I can get you there in 8 weeks. But I try to give myself some wiggle room because sometimes people miss sessions, things happen. So, even with me, my life is super busy right now. So I don't allow myself to invest in someone at $150 a session rate or $100, whatever the rate is, for them to walk away. Because if you do therapy, then you know that the work is done at the beginning. The work is always being done, because as you see patients and you work with them, your therapy goals may change. or you may need to make some adjustments. That's normal. But the bulk of the work is done when you do the evaluation. And my evaluations typically occur over 2 or 3 sessions. I don't believe in doing an evaluation in one sitting, one session, because that could be a bad day. That could be a really good day. That is just, it's too much variability. And I'm not spending that much time with you in one session, one day up front, because the way that I do my billing, I need to I need to maximize my billing. So not that I'm repeating eval codes, because most insurers will not allow us to do that. Some will, right? Some will allow you to bill 92523 every time you see a patient, but most commercial plans will not allow you to do that. So since I cannot do that, I have to be strategic about, okay, how am I going to, be able to provide the best service for them, and to document accordingly so that these insurers know what we're doing. And I'm not just putting 92523 and 92507 for everything, because I'm doing way more than that, especially if it's like a young child and I'm doing some additional, a type of assessment, some developmental things. I need to put the right codes in there. So I want to make what I deserve to make, just like if you go to a doctor and they make what they make in their session, I should make the right amount too. So, but again, thinking in private pay is usually a package deal, because one, I can't bill your insurance. So two, I'm going to still put a lot of effort in. I'm going to still put, my best work in. So I need to make sure that I'm getting paid. And again, I do pro bono all the time. I got 3 people on my caseload right now, pro bono, right? And they are draining, but I love them, right? Because they cannot pay. So I'm not saying that everybody has to pay, but I'm saying if you want to do your private, if you want to see private patients and you want to be able to predict your revenue, I think the best move to make is to bill in a package way. So you're telling them, look, I'm not, like, I've done the $100 a session thing. Most of my sessions were $150 a session. And then, if you're a friend or family, you got $100, you got $50 off, a $50 discount. Especially if it was like a home visit. If it was an in-office visit, then, I could do $100 session and I might give you a discount. Maybe it'll be like 80 or something like that for the session. But I was finding that just was not working well for me. But when you do a package deal and you're doing the bulk of the work kind of, oh, that's not good color, kind of in the front, like the bulk of the work is up front. This is where you're doing all of the work. Then at least you can get, like 50% of that money, because you're doing so much work. And it also keeps the clients kind of committed to working with you. And then as you're doing, you're moving along the continuum, these are all your individual sessions. It's easier for you to plan your sessions, because you're planning your sessions based off of the bulk of the work that you perform here. So now when you have your end game, like when you do your final assessment, or you do, your like review for your data monitoring, you could say, okay, you can compare these two, and you could say, wow, when you first started with me, you were doing this, you were doing that, you were only speaking, and maybe you were only stuttering, you were stuttering a lot. Let's say you were stuttering, your disfluency index was 23%. Now your disfluency index is 10%. So your stuttering has significantly went down since we've been working together. Also, I've noticed that, you're able to speak at a faster rate because you're not stuttering as much. So your rate of speech has gone up. So now your rate of speech has increased by 25%, which means you're able to get more words out in less time. When you first came to me, your rate of speech was really slow, whatever the rate was that you decided, calculate. So you could say that. And then you can also say, and I've noticed that overall, your overall intonation and articulatory patterns and your intelligibility is much clearer. When you were with me, your percent consonants correct were only 68%, and now you're so intelligible. Your PCC, your percent consonants correct is 85%. So I mean, I know your friends and family are telling you that they see that you're making progress. I know that, like, you told me you've seen some, changes, but I want you to know that they're like literally observable. The data is speaking and suggesting that you're making changes. So, do you want to continue for another term, right? Because you're not lying. You know what I'm saying? Like, this is, the data speaks for itself. So I like to do private pay. I would say you need to do a 50% deposit upfront. If you can't do that, I'll try to work with them, but generally I want a 50% deposit, because this is when I'm doing the assessment and I'm doing diagnostic therapy over the first like 2 or 3 sessions. So this is diagnostic therapy, maybe these first 3 sessions, or so if I go like this, The assessment session is 1, and then 2 and 3, those are diagnostic therapy sessions. And then after that, I'm pretty clear on what my goals are, because I've been seeing you 3 times. So in all these 3 times, you've been stuttering. All these 3 times, you've been, having breathing difficulties. All these 3 times, you've been having feeding challenges. Whatever the issue is, I've seen it. So then I can say, okay, within 4, 5, 6, 7, and 8, those sessions, we can really hone in and focus on treatment, because your treatment is based off of where your weaknesses are, where your child's weaknesses are. The baby was not sharing. The baby was not, if the baby's on the spectrum, the baby was not talking. Your child was not talking. He had no words, right? He was not using language effectively. And we've just worked on, increasing his intent to communicate over these last few sessions. And now we see that he's now showing interest in making requests, using one word or maybe using a sign, but he's doing it. He was not even looking at you and making requests at first. He didn't even know you were in the room, right? So then when I have like my last 2 sessions, so 9 and 10, these 2 sessions are going to be my evaluations again, where I'm now like, because again, the first few sessions were baseline data and my initial assessment report, and then my last 2 sessions are going to be my final assessment, so I can say, how they've changed over time. So this is why research is so important. But don't nobody want to do research, but research is so important, because if you can do research, you can do anything. So now that, I have data, I can give that to the family. And then when I go to IEP meetings with my family, it's like, who's going to argue with me? I have relevant data, it's accurate, it's based on what the client is doing. It's it's like I said, it's relevant. It's not just like, oh, I use this tool because this tool was available. No, I use this tool because this is the skill set that the client is presenting a weakness with, and I'm able to bill for it. So, if they have a voice weakness, I'm billing a voice code. If they have, a language weakness, then I'm billing the language code. If they so I'm able to bill based off of what I see is going on. So the insurance typically rewards me for that. But if they're private pay, I'm getting a flat rate. So I'm almost taking an L unless I charge high enough to cover, what I typically will be getting from insurance. So as most of these SLPs, they base their hourly rates off of like what other people are doing. That's price fixing. You're not supposed to do that. I base my rates off of what would I get from a general insurance company? What would I get from Care First for a client that looks like this? Like, and don't ever base your rates off of one session. That's stupid, because your sessions, you do different things. Some sessions are assessment sessions. Some sessions are treatment sessions. So why would I just be like, yeah, give me $100 every time you see me? No, no, no. Now that's like working for, like, my time is too important. And if you have a problem and I can fix your problem in 10 minutes, and Nancy can fix your problem in 10 weeks, who you gonna go to? You gonna come to me. Why would you go somewhere and pay for 10 weeks of getting your problem fixed if you can get your problem fixed in 10 minutes? So it's not about how much time I spend with you. It's about, am I fixing the problem? Like, am I helping you get to your end goal? Like, that's the game. So if you're, basing your rates like, oh, I just want to, charge $100 a session because Nancy charges $100 a session, you're going to be capping your potential here, and you're going to be missing opportunities to get better revenue, unless that's just, you want to provide a good service for you. Like I said, you have friends and family, you want to make sure that they, because I've done friends and family for free, and sometimes, they don't show up, they forget, they don't want to come because they're not, it doesn't cost them anything to show up. So sometimes, you might just want to just give them a rate to just charge them to cover your expenses. And because I can tell you, and I've mentioned this before, I've done pro bono before, and then families have decided they wanted to sue because maybe they got empowered by coming to therapy and realizing that they were being mistreated wherever they were, or misdiagnosed wherever they were. And so now they're ready to sue. And because you did therapy pro bono, and you got to go back and get all your records, go back and do everything. So it can sometimes, set you further back. So that's again why you might want to just say, you know what, I'll just give you a flat rate to cover just anything in case, so that I can just document accordingly and have everything nice and formal in the event, God forbid, you're ready to sue the school system, or you ready to sue, XYZ company. At least I've got my records like formal, and I put my best effort forth because I was getting paid something. So for that reason, go ahead and charge your little flat rate, your $100 a session. But otherwise, I would not recommend you tell people that you charge $125 a session. I would recommend you tell people you charge a package rate. for 10 visits or 12 visits or whatever. And all of this is bundled in. The assessments are bundled in. The progress monitoring is bundled in. It's not, because why would I come to you and you like, oh, I charge $100 for a speech eval. Oh, actually, your baby has a tongue thrust, so that's going to be an extra $250 for myofunction. Oh, actually, you know what I'm noticing? He's got some language problems. You're going to need to give me $300. I'm going to feel like you're trying to take something from me at this point, and I'm not going to be happy, and I'm probably going to report you. So, don't do that to people. And a lot of private practices that I've seen, that I've either worked for, worked with, that's something that they do. It's like, they notice things and then they want to charge families for it. And it's like, you shouldn't be trying to I don't think that's right. So I would just say cover yourself in the beginning if you're doing private pay, and do a package rate based off of what you think you would have made from the insurance. Unless you don't take insurance, then you got to figure out, what your time is worth and how you want to go about doing this, considering that they might need evaluations in 4 or 5 areas. Don't ever look at it like, well, they telling me that the baby only needs a speech eval. How you gonna let a family tell you what the baby only needs? You the professional. The baby might need a speech eval. Maybe they will refer for a speech eval. But what if that baby has, a feeding and a swallowing problem that went undetected? You just gonna leave it alone? No, right? We need to address these issues. Even if you are not the expert, you still might need to screen it and refer out, but you don't want to just leave things unaddressed that are within your scope of practice. That is not practicing at the top of the license. Now, if you miss it, you miss it, but you don't want to just knowingly be aware that there's an issue and you not address it, because now that's an ethical violation. Okay, so, it's 5:43. Let me see if I can do another question. So I don't have any questions here, so I'm gonna go back to my questions. Can I do, no, she said, can you, with seminar? I do have a seminar, but I'm not sharing that anymore because, as I do things, I want to update things, so I'll do a new one eventually. Is it possible to work from home doing telehealth through insurance companies? If so, can you recommend an insurance company platform that's simple to work with? I'm licensed in Florida and in New York. Okay, so yes, generally speaking, you can do telehealth from home with most insurance companies, but there are insurance companies, especially, I don't want to say insurance companies. Okay, so we know insurance companies are MCO, so managed care organizations. So with Medicaid, now Maryland Medicaid specifically, if you are in network with Maryland Medicaid, you might want to look at the new announcement that came out. I think it was actually like last week. They were saying that you can no longer, in the coming months, you will no longer be able to bill Maryland Medicaid if you're providing therapy from your house. This pissed me off. I need to sip off of this one. Yes, you can no longer bill Maryland Medicaid from your house if the client is also at their house. Somebody has to be at your office. So if you're in your office and your client is at home, you can bill telehealth. And I don't know if you're aware, but Maryland Medicaid reduces your rate for telehealth for at least 92507. They don't reduce the rate for the evaluation codes yet, thank God. But they do reduce your rate for 92507. So you cannot bill Maryland Medicaid from your house, and you can do it right now, but there's a time coming, and I don't know if it's the end of this year or when, where you would not be able to bill Maryland Medicaid from your house. You will have to be in your office. There are other insurance companies across states that have these same policies. I believe Texas is one of them, but I'm not sure, because Texas has, of course, different Medicaid. So I'm speaking about Texas Superior, but you need to double check that. So if you are in network with like Care First, I think that's fine. If it's a home office, that's fine. But yeah, so it can be tricky. So just make sure you look at the policy. Every insurance company, every MCO, even Medicaid, of course, Medicare, right? CMS, but Medicaid is through the state. They're all going to have a speech therapy policy. So you want to look at the medical policy as well as the speech therapy policy. And then sometimes MCOs will have a telehealth policy. So I highly recommend you use the telehealth policy, the medical policy, and the speech therapy policy, because if they overlap, some things, they might not put it in both policies. Okay. So I hope that answers the question. Do you use Simple Practice to build your website? Or do you use your own website? I use my own website. I don't use the Simple Practice website because they might not like me saying this, but I don't like it. So the Simple Practice website only gives you the scroll down option, like on your pages. I prefer to have a website with multiple pages. So, because I have a research lab that I'm a principal investigator in, I have SLPs that I'm coaching. So if you find my speech therapy website, I want you to be able to find my SLP coaching website, easily. I have a blog, so it's like I need to have multiple, and that's just not even dealing with the speech therapy company. In the speech therapy company website, I also have a patient portal, we've got like about us, the team. So we need to have multiple pages. So with the Simple Practice website where you just scroll down, that's not sufficient. And also, I don't think it's good for SEO. So by me having these multiple pages, I'm able to set the SEO on each page. And so that increases my, what SEO is, search engine optimization. So I'm able to be detected by Google more because I'm putting target keywords in that are going to make my website rise to the top. So that's another reason why I don't like using the Simple Practice website. And I don't like anybody having that much control over me. Okay, I'm already paying you to use your EHR. You're not about to own my website too. Okay, so next question. Hi, I've had 2 insurances. Oh no, Instagram just died. So, gee, Instagram, that phone just died. Okay, so I have had 2 instances where patients are only able to speak Spanish, and unfortunately, no one in our facility does at this time. Is there some kind of medical translation system, HIPAA friendly, that you could recommend? All right, so for Spanish speaking patients, when I used Jane, it was a nightmare because I had to upload everything. Technically with Simple Practice, it's not that easy either, but it's a little easier because Simple Practice has these different little alerts. So at the bottom of my alerts, I can put language in Spanish. I put English first and then I put Spanish next. So that makes it easier for me, like an appointment reminder, for example, or you have documents pending that you need to sign, something like that. For translation services, though, I don't need translation services because I speak Spanish, but I have used translation services when I worked with, or still, I see schools use them when I go to IEP meetings at schools. And the ones that they use in DC and Maryland are, I don't know, these are not good. Like, I don't even want to mention the names of the companies, but my goodness, these are not ideal. And so I would not recommend them, but if you had to, you could use them. You could, call them up and then you just put them on speakerphone and then you speak to the client and they translate. So something's better than nothing. So, I mean, you could use them. I would not recommend, as this person was asking, like a system, a medical translation system. I would not recommend that because that's like Google Translate, and that I don't believe is HIPAA compliant, number one. And they did mention that they wanted to be HIPAA friendly, but I wouldn't go that route. I would really focus on using a human being to translate for me. If you have to hire someone, maybe that's an option. You can hire them. That way you can train them to use speech language pathology words. You can have an agreement as to what words you want them to use. Because remember, in one country, they might say terapéutica. In another country, they might say terapista, right? So you want to have like, an agreement like, okay, these are the words we're going to use for therapist, right? We're going to use tartamudez for stuttering, fluidez for fluency. You want to kind of say like, these are the words I'm going to use. And, so you can kind of, if you train someone, I think that's a better deal. So if you get a VA or a speech language pathology assistant who speaks Spanish, then they can help you with doing that. And then you can translate your documents and just be done. But I would not recommend using an online system to translate unless you absolutely have to. And if that's the case, that they really don't speak English at that level and you can't communicate with them, you might want to refer them out or let them know, like, I don't know if I'm best suited to help you because, I cannot communicate with you. So you can let me know what you think about that. But yeah. Hi, thank you. Thank you. Okay. If you use Simple Practice, since you use Simple Practice, is it worth it to switch to the Plus option? Right now, I have the Essentials version, and I'm thinking about switching to Plus for the option of adding administrator and the ability to color code appointments. It's $30 more, so just wondering if it's worth it. So I said that color coding is nice, but not necessary. I think that switching to Simple Practice for that is not worth it. And I don't like their telehealth platform. I said that earlier. I think that telehealth, now, most simple practice was designed for mental health professionals, not for speech language pathologists. So they said that, right? But it so happened that it works well for other providers. So now they have OTs, SLPs, oral myofunctional therapists, all kinds of providers, chiropractors using simple practice. So now they see a need for making it more customizable so that other providers can use it and use it efficiently. That being said, the overwhelming majority of users of simple practice are mental health providers, so they like the telehealth platform in general because they don't need to do anything but just do what I'm doing right now. But if you are a speech language pathologist and you serve young children or children of, like, I would say any early adolescent, sometimes even high schoolers, I mean, even adults, I like to screen share. I like for my client to be able to control my screen. Sometimes I open up my screen on Zoom and the kids are able to control what I'm doing and click on the buttons. They love that. It keeps them engaged for longer. If they're engaged for longer, right, then you can do more with them. Sometimes you can build more. So, if you're going for length, right? Time codes. So yes, like I want to have a telehealth platform that is easy to use, that is easy for the people on the other end to use, and that is convenient. I love the simple practice sends alerts and it sends the link to the clients to the telehealth platform, but I don't like their telehealth. So even though I use the plus option, I don't use their telehealth hardly at all. Like I even disabled it, I think. I use Zoom. And so, yes, I don't get to send everybody a reminder with a new link, but I'll just set a link for my clients and just send them the link and that'll be it. And I'll just keep it pushing. And Zoom allows me to record my sessions. Simple Practice doesn't have a recording feature. Zoom recordings go into the cloud, which is much easier. I have the Zoom HIPAA, for healthcare providers. So for me, it's Zoom all day. But I still think the plus option for simple practice is good. The color coding is nice. And I just think that the system is a good system. It's easy to document, it's easy to build. And so for that reason, I still like simple practice. All right, last question. And then I'm gonna be done. I've done this for an hour. Okay. All of my claims are getting denied for United Healthcare. The rep told me I needed a modifier, but refuses to tell me which modifier to use. Can you please help me? So the answer to this question is you probably, if all your claims are getting denied and you need a modifier, the modifier is probably GN. So most claims for United Healthcare will require you to use a GN modifier. Sometimes you have to also identify whether or not the session is habilitative or rehabilitative. So you might need another modifier. But in general, GN lets them know that it's a speech therapy session and you should be able to get it through. Okay, so that is it. I am done. I hope that you enjoyed and that you got something out of this. And I'll probably be going live again, but not tomorrow. So yeah, thank you so much for tuning in and for the likes and for the support. If you want to know more about me, my speech therapy website is www.speakwritethink.com. So that's SPEAKWRITETHINK.com. And my SLP coaching site is savvyslp.com. So SAVVYSLP.com. And I think that's it. Yeah, I hope you have a good one. Bye.